There may be a new COVID-19 side effect that affects children. It is called MIS-C. And cases have been reported in the Palmetto State. WSAV News 3's Andrew Davis is joining us from the Lowcountry newsroom to explain.
Well, the first two cases of multisystem inflammatory syndrome for children, or MIS-C, hit South Carolina this weekend. Those two cases, both in children under 10, one in the Midlands, one in the PD area. Here in Beaufort County, there have been no cases have come up, but doctors have been talking about MIS-C and the viral trigger that is COVID-19 for kids for months.
It felt like almost electricity or fire coursing through my veins.
I couldn't really do anything because I was in a lot of pain.
Just some of the 300 cases of MIS-C that have hit children around the nation so far, a syndrome that has now reached the Palmetto State.
It does appear to be a post-infectious phenomenon. Having this may have had mild illness with the COVID-19 itself, but then they have this secondary reaction somewhere between 2 to 4 weeks after their illness or exposure.
An exposure that starts with a fever, skin rashes, then gets much more dangerous.
Seizure, stroke, renal failure, liver failure, bleeding from the GI tract. They can have elevated heart enzymes, similar to what people track in adults for heart attacks.
Doctors call it a potentially life-altering when they do recover. Heart, liver, or kidney damage, all possible. 80% of patients end up in the hospital in intensive care. Most kids, if they do get COVID-19, are probably get through it fine. Most are asymptomatic or mildly symptomatic. Only a small percentage are going to go on to have this inflammatory response. With the closure of schools and kids being at home, they just weren't being exposed. So now that we've had relaxation, people are going out and about, not protecting themselves like they should, that just brings the virus to everybody else. Now, children with autoimmune disorders or defects, as well as African Americans and Hispanics, seem to be at higher risk. Dr. Ellenberger says if your child has a fever, they may not have COVID-19 or MIS-C. Just watch to see if they're lethargic, they're not responding to the medicine, they're vomiting, or have a rash. Then you may want to take them to the doctor, just in case. Andrew Davis, WSAV News 3, on your side.
Andrew, thank you.